everyone. Welcome to our Graduate Medical Education Board, their final meeting of 2025. Good to see everyone. I think we're waiting on a couple more board members to join virtually, but I'll go ahead and call the meeting to order. And I would ask Lucas if you could call roll, please.
Dr. Jennifer Choi,
Here.
Dr. Steve Becker, expected to be virtual. Dr. Cliff Knight, here. Waiting on our fourth appointment. Dr. Rachel Shockley, here. Right. Angie Sagel Hannon,
Here.
all right. Dr. Kevin Gepke, expected to be virtual. Not yet. Rob McClin, here. All right. Dr. Grace Grice,
Here.
right. Dr. Tricia Hearn,
Here.
and then our student members, McLaren Tobin, here. And Kaylee Ryan.
Here.
All right.
Okay, wonderful. Let's go ahead and get started then. So the first order of business that we'll focus on today is just running through our minutes from our July meeting. So hopefully you had a chance to review those. And you want to take a moment to scan through them. They're on page 1 of the package. And I'll take a motion to approve those minutes.
And just a note on those minutes, in the printed packets, it says October 30th. That's been updated to reflect October 24th today. So
Okay.
that means
So
it's
we're
already
meeting
been,
today.
yeah, so it's already been made.
Clarification noted. Thank you. Second?
Second.
Thank you. All in favor of approving the minutes, say aye or raise your hand if virtual.
Aye.
All right, any opposed? Okay, our minutes have been approved. Okay, let's move forward. We're going to follow our more new, calendar cadence that we have, or not that new, I guess it's been more than a year now that we've been doing this. But Lucas has done some great work to allow us to get our updated progress reports from each of the recipients of our residency expansion grants. And so he included those in your packets. Hopefully you've had a chance to review some of that, but I'd like to turn it over to Lucas to just kind of give us a summary of all those programs and the updates that they provided us.
All right, thank you, Madam Chair. So the board has nearly 100% response rate from the programs. There is one program that has not responded yet. That is the Northwestern Indiana Psychiatry Program in Gary. We have had contact with them. Small World, Linda Bratcher actually works with them now. So that report is forthcoming, just not present today. When I have it, I'll update this document and distribute it all to you. Starting with the overview, these are sorted by specialty first. The number to the right indicates if there is more than one grant that's been awarded. You'll see that in the individual profiles. Then sorted by institution. The only note with that is that Porter Hospital LLC is the same as Northwest Health Porter and your residency expansion scoring for today. So just to avoid any confusion, those are the same grantee. And then the ACGME code, in case you would like to do a deeper dive beyond what is in the report today. This has been formatted and edited. If you would like the raw reports, please let me know. The only difference would be that those include NPI or resident rosters, graduate rosters, and budgets. So if you'd like to see that, please let me know. We are looking at 20 grants today, spread across 11 grantees, totaling just over 20 million. Some of those are for one resident, and some of them are up for about 16, right? So there's a large range. I really wouldn't go by average for that. The small map on the left is for this reporting grant period, which is indicated on the next page. But there is no program development, no feasibility. This is purely residency expansion for this report. And then a graphic kind of depicting spending across the specialties. So pretty straightforward on that. We will look at the key takeaways. I'll read through those and then board members can, review the rest of the document at their leisure. Key takeaways: the top funded counties, Knox County, Allen County, and Vanderburgh County, respectively, received the most funding, nearly $5 million. Recent program growth, I would look at this more as matriculation. Of the 11 programs, 6 have received initial accreditation in 2022 or later. So I think that's showing, the next stage of those program development grants the board funded years ago. So, some pretty rapid expansion, exciting to see funding by specialty. no surprises. Internal medicine has received the most funding due to class size. And then the two specialties that are not present in this report are emergency medicine and the outpatient community-based pediatrics. Emergency medicine has been funded previously, just not in this grant. Yep, the grant periods that we're looking at today, 2021 to present. So a bit of context about what we're talking about. Resident volume by specialty, internal medicine is training the largest number of residents with 91 spread across 6 grants in this report. I thought this was particularly interesting, 0.5, because maybe we haven't had great oversight on it previously. But grantees reported 31 residents over the CMS cap out of the 177 in this report. Nearly half of those came from the Southwestern Indiana GME Consortium Outpatient Community-Based Internal Medicine Program. That's a mouthful. And there is the ACGME code if you would like to look at that as well. I will read through.
And this is just by self-report, whether they're over the cap or.
That's right.
Yeah.
I will read through points 6 and 7. They're summaries of all the written responses that were collected. If you think they're good, I'll take credit for it. If you think they're less than good, AI assisted me with it. All right. Point 6, curriculum exposure to underserved areas. Residency programs are deeply embedded in communities with significant health disparities. Residents train in federally designated rural zones, health professional shortage areas, and medically underserved areas, including Central Fort Wayne, Grant County, and Marion County. Continuity clinics and inpatient rotations serve low-income, uninsured, and high-need populations. Programs also incorporate community-based experiences such as volunteering at free clinics and rotating through federally qualified health centers. These settings provide daily engagement with social determinants of health and complex patient needs. Through interdisciplinary collaboration and hands-on care, residents develop the skills and commitment to serve vulnerable populations, many continuing to practice in underserved areas after graduation. 7, impact of the new residency expansion grants. The grant has been instrumental in launching, expanding, and stabilizing residency programs across Indiana. By covering resident salaries and offsetting operational costs, it enabled institutions to invest in curriculum development, faculty recruitment, and educational infrastructure. Programs grew in size, added leadership roles, and strengthened research and career development pathways. Achievements include increased scholarly activity, strong ACGME survey results, and high retention of graduates within Indiana, especially in underserved areas. Programs also reported enhanced diversity in resident cohorts and expanded clinical partnerships. Challenges such as faculty engagement, leadership transitions, and financial pressures were addressed through strategic planning. A key lesson learned is the importance of early investment in retention strategies and educational quality to build a resilient physician workforce. So each of the profiles that follow in this report have the verbatim response. That is just a summary. And point 8, future funding intentions. Franciscan Health Indianapolis is the only program that notified that they do not plan to apply for residency expansion next year. And the next page will explain why. So moving on to our first profile, Franciscan Health Indianapolis. The top is, gathered from the report or the response and/or ACGME. The small map on the right only indicates location, nothing about resident volume or funding. The PO is meant to indicate if there is more than one grant that's been awarded. So if you look at that first page, family medicine SIGMEC, Parkview General Surgery, you'll see more than one entry on those pages. I'll explain a bit more about that later. The approved positions, filled positions, and positions funded by expansion grants. That third box will be important to understand in conjunction with the two following sections. You'll see some discrepancies. A couple of these programs only had one resident funded, and to get a better idea of what was actually happening at that program, we asked them to report on the full program. So, for GMED purposes, you'll want to look at that second box, but the demographics just for context. And then, like I said, the point that I found most interesting would be the CMS cap. You'll see those on some of the profiles, but not all of them. Okay, and then at the bottom is the rotating sites or the participating sites. So to kind of give an idea of, what do these programs actually look like? Is it all in one building or is it spread across the state? Okay, so let's look at Go to the next page, SigMed Family Medicine. That will be page 11 in the individual report, and it's on what page? And our large agenda. Page 13 in the large agenda. So this one has multiple grants that have been awarded. You will see a decrease in 2024. If board members will recall, the board voted to approve grants for each applicant at a limited term of 2 years rather than the full training cycle. So you'll see some decreases in the 2024 year. Like I said, those written responses, those are the verbatim, answers that we were given from the applicants. So, free to read those at your convenience. And then, a final point that I'm happy to take questions is the residents. So, it's been a discussion since I came to the commission and began working with the board, and geez, I was February of 24. When I started, we had, insight, I guess, beginning insight to around 90 residents. As a result of, these expansion grant reports and the work that Greg Harrell did and Eugene Johnson, our, I guess, inventory of residents has grown to 392, right? And we will continue to increase that. It's not at a point today where it can be reported. I would recommend, staff would recommend engaging a third-party vendor, one, to provide credibility, two, accuracy, and to not reinvent the wheel. But I think we're pretty close to being to the point where some great insights will come. You'll hear from me. I promise, probably more than once. We have that. So with that, it's a lot. Are there any questions about how to read this report? Anyone online as well? Yeah, this report starts on page, I think it was 13 of the overall agenda. Everyone has access to this.
And remind me, look, if we get some questions around, like, maybe it's in the text too, like they're all have continued accreditation and more initial, they're all in good standing. Or no big financial issues that came up as you reviewed their financial reports or budgets that they submitted. Okay. That's great. Any other comments or questions or clarification? If we can optimize this, because I think this is the first year we've done this report for this particular grant? I can't remember.
We've developed it a bit more.
Yeah.
Last year's was a bit superficial and just numbers. So those demographics is kind of what we had last year. Now we have a bit more of that narrative base that we discussed.
I found it very useful. Yeah.
All right.
The format, easy to read. And lots of questions we asked, and responses were very helpful as we read.
Yes. Well, and if board members have, recommendations on questions to include, we will start collecting these, I believe it's around July time. Next year, I'll start reaching out to these institutions again.
I think this is great. It helps us, just, have line of sight to where all the grant funds have gone, how they're being used, make sure we have close that loop. Whereas earlier on in our journey, I think we sometimes have these reports and not always as consistent, but now Lucas has really developed, I think, a well-oiled process that's consistent, and the programs are now know what to expect. And we're getting the feedback that we, just to know that we're continuing to provide these funds to strong programs that are. Thank you.
Yeah. And then,
Can I ask a question? I'm sorry. So, some of the demographic data that you put, like male, female, and then race, that's great. I'm just curious, is that just an FYI, or was there some directive or initiative to use the funds a certain way with regards to this?
no, just an FYI.
Okay.
Yep, just for insight. And then, Dr. Becker has joined us, so, great. We have one more board member.
Wonderful. Okay, fantastic. Any other comments on this before I move us on to the next agenda item? Okay, well, thank you, Lucas. This is great work. I bet this took a lot of time behind the scenes. So you really did a nice job creating the summaries of clear and, crisp reports. I appreciate that very much. I know the board does. Okay, so now we're gonna move to our old business, and this was, the focus of our last board meeting in July, where we, had a motion at that meeting, as we all know, to table, the voting and on the approving these grants, because we were hoping that we would be able to obtain additional funds from the state. At this time, we do not have additional funds that we have procured for these grants, so we are left with the balance of, is it 6.2 million there? Yes, 6.2 million. Unfortunately, we had hoped we would get another 6 million-ish from the state, or anywhere, really. We would have considered any sort. However, we are back to our agenda from the July meeting, essentially. And so we will be needing to review each of these grants that were submitted. Let me see, what page do I need to be on here to guide us through this?
That is page 30, it looks like.
Okay, yeah, page 30. So on page 30, you can see the grants that had applied for the expansion grants that were due in July, or that we reviewed in July. We had scored the grants based, as a board. This is all of our scores, and they're totaled and prioritized based on the highest score being at Marion, and then Ascension and Northwest Quarter, all the way down to the lowest one here based on score, Southwest Family Medicine. So we are going to have to vote on these today. We will vote on them one by one, and when we run out of funding, then we won't be able to continue to vote. There will be no more funding to allocate to those grants.
Madam Chair, just, a reminder from the discussion at the previous meeting, the Northwest Health Porter unique application with a score of 51.8 has been marked down to $540,000 to avoid retroactive funding. That is the same program that the Northwest Health Porter Family Medicine 45.3. Same ACGME code. One is for a cohort that started last year. The other is following the same protocol as the rest of the applications. So just a reminder, that is the difference between the two.
So there's the 540 up at in the third position, and then there's the 810
810.
down below.
The same program?
Same ACGME code, same program, two separate cohorts. And so that was a developed understanding on that grantee's behalf. They did not know they could apply for more than one grant at one or consecutively. So they had just missed that window last year to apply
So essentially, it's starting, the top one is starting
during
for the
PTY2,
to do PGY2 and beyond, because they missed the PGY one.
where the 810,000
We'll
PGY1.
pick up that PGY one class behind them, and then follow them all the way through.
Yes.
Madam Chair, as we go through and vote, are we going to combine those two together? And are we considering them in the order they're listed here, or are we gonna have that discussion with Northwest combined together?
Staff would recommend against combining them.
Okay,
The reason for the higher score is it was established, 1 year prior. So that's the only difference between those two. But staff would recommend looking at them as two separate grants.
Any other questions before we?
and today we have the full 6.2. There's no reason for us to reserve any other dollars for anything else in the remaining fiscal year, correct?
Correct, yep, and this is through June 30th, 2026. The next day, board will receive the next round of appropriations, and the state's fiscal year 27 begins.
And we do the new program development grants in April.
Previously, the board has approved those grants with the understanding they will not be signed until July.
July 1.
And so those will be the first, dollars taken
Able
out
to fund them,
of the
just
next
not
appropriation.
in April.
Okay,
So it won't preclude us from funding new program development.
And that's what we've done historically in the past.
So it's not different.
That's what brought us to the 6236 that we have today. Yeah, there was one program development and feasibility approved earlier this year.
And, yeah, and the feasibilities can come at any time, but the big, they're about 500,000. Ones that we entertain in April, so those we can fund with the funds that come after 11.
And for the board's awareness, I have at least one program development potential applicant that has communicated they plan to apply. I believe it's two. I have to go back and check my files, but one reached out to me a week ago.
Yeah, so we expect to have some business there. Okay. Yeah,
I am the DIO for 3 of these, and so I'm just kind of curious how we want to handle conflicts. Then you have several members involved.
Right.
yes, it's a good question.
So we will need to invoke the rule of necessity today. So board members, do have the ability to vote.
Yeah, do we need to go through them one by one or not necessarily? Because some programs would have more conflicts maybe than others.
Right.
But
Or do we need? Yeah,
Just a whole lot of conflict.
there's a lot. We know that this is always the case, this is always the case because we have so many of us in our home roles have this, are involved in these programs. So typically, we need 6 votes to, so if there's how many of us on right now? 8?
8, correct.
So if people recuse themselves due to a conflict, we could vote. If 3 people recuse, we have to vote. Necessity. I do have that right.
Two. And this is Michael Nossett, our general counsel. So
I apologize.
Sorry for the strange new face here, so,
Yeah, I
yes.
forgot. I
he will
totally
be our
forgot.
North Star.
Yes. Yes, Josh, we worked with Josh Garrison in planning for this meeting, but there's something came up, so we
Indeed.
we
I'm
have
a
our,
good guy for
have our
Josh Garrison.
council.
So, but I'm very familiar with you also. Good morning. Some of you may, hopefully don't remember me, but I may be the reason why some of you are here. I used to do appointments for Governor Holcomb, so apologies for any of that process, but thank you for your service, sincerely. But no, certainly happy to answer any questions, and I serve as general counsel to Secretary of Education, the general, and then for the Commission for Higher Education. So happy to be with you all today. And this is the nature of I need to do. I will admit a little bit of work on the rule of necessity, just in terms of the way this is all set up. You all, there's inherently conflicts in this process, so that's something we may need to going forward. Work with structuring for you all, just so you do feel comfortable in the Ethics Commission and all of that. So we'll go ahead and move forward today, and then be looking for some paperwork from me in the future once we paper this over a little bit better. But there's just inherently so many conflicts in this process that we'll get all that straightened out for you all.
Yeah, but some there may be no conflicts, and some there may be
Indeed.
several. So should we go through each of these grants and discern individually how many conflicts we have? I want to make sure I understand the right process versus uniformly saying we have to invoke rule of necessity.
That would be nice.
Let's do one at a time.
That would
Okay,
be great.
all right. So any conflicts that anyone wants to report on Marion Health? Hearing that. Ascension, St. Vincent, Evansville.
I do.
Necessity on that grant. Okay, Northwest Porter, conflicts? Southwest Indiana, internal medicine.
I do.
Southwest Psychiatry? 3? Same 3, I presume?
Yeah.
Yep, okay, then we'll vote rule of necessity, Northwest Porter. Any conflicts? No, we already did that. Parkview Health, any conflicts in the room? On the board, and the board members, no. Northwest Porter, again. no conflicts, and then Parkview, no conflicts, no conflicts, and then the final, Southwest, Family Medicine, same three. We'll vote, you know, essentially, everyone will be voting for all three.
And then for the board's awareness, Dr. Gepke is on the call now. So
Okay,
we have our 9.
well, does that
And
change?
I'm sorry, just to clarify, I've been on the call. I was on the phone and I just switched over to my computer, so I've been on the whole time.
Thank you, sir. All right.
Okay, that changes. So now we have, we have 9 board members. And if we have 3 people recusing, we actually have 6 to vote.
I think that was the most we had.
Dr. Gebke, do you have conflicts on all the same ones, Southwest? I mean, do you want to share with us which ones you feel you have conflict of interest on?
I don't have a conflict because technically I'm IU Health. I'm not IU School of Medicine.
Okay, so in this case, Ascension, the 3 folks who wanted to recuse, should recuse. In South, and then the Southwest, also, there's 3 Southwest grants, and then those folks also should recuse and not vote.
And that brings us towards.
I guess that's right. Done. Okay, this is complicated, but I think we got it. Okay, wonderful. So we've got clarity. Do we have to have them step out during the best practice or?
I mean, you refrain from discussion. You can certainly do that by have folks step out or just refrain from participating in the discussion.
Okay,
Whatever-
well, yeah,
Yeah.
okay. I think we'll do refrain from discussion if that's okay.
And vote. Refrain from vote.
Yeah.
I guess I'm struggling with refraining from discussion versus just not voting. I feel like they may have information that's really
Right.
important for us to hear about their organizations and
Correct.
things. And so I would prefer not to exclude people from the discussion, but they just wouldn't be able to vote.
Yes,
That-
yeah, I guess, once we call them, may want to, well, trying to think how, what I was thinking, and you can, please guide me, is that we'll discuss these as they come up, right? And then we do a motion, a second, and then discussion. That discussion, I think, should not be. Do you know what I'm
Available
saying?
to answer questions.
Correct.
As
But
we
before,
normally do.
I think we'll have a discussion, like an open discussion about each grant, and if there's questions, so then, once we get to the formal business, then it'll be, you know, the motion, the second, and then a discussion, and then a vote.
I think that's why, if I could. Madam
Yeah,
Chair,
yeah, please.
These, what the code says on these matters
Okay.
is that, whatever here, if an appointee has, let's see here, an appointee may not participate in any decision or vote or matter relating to that decision or vote. If you have knowledge of a financial interest, you can essentially give conflict of interest because of your employer status. So I would say maybe to answer questions, but it is.
Should I introduce each
In
one?
terms of voluntarily contributing to the discussion or being part of the decision than just back
Okay.
out.
So I'll invite people to add information if needed, as we have our discussion, how's that,
That's wise.
before the motion?
Again, apologies to you all. This is the nature of many of, not only your entity, but so many other boards across state government. We want you here at the table, but by virtue of you being here at the table, one of the reasons why you're here is because of your affiliations and experiences. And sometimes they just get muddy. So, shoot the lawyer. You're welcome to throw stones. But again, thank you for muddling through the process.
And I'm just gonna ask one more question for my own guidance of the chair, because we have this situation happen where there is no one on the board who is representing one of these entities, and then they might be on the call or visiting as a public member today. I can invite them, if there's a point of clarification we want from that program, we can ask that. I can invite that.
That's correct.
Okay. This is.
I've been here honorary JD.
I'm learning a lot, okay. All right, excellent. So then we are going to, and these scores were all compiled based on, just as a reminder, the pre-populated scores, because there was a section, if you remember how Lucas has done this for us, we all went in, some of them were pre-populated, right? The objective ones, the ones that were perceived as being very objective, like the, ratio of primary care physicians and that area and then we went ahead and, as board members, put in our scores for the strength of application, the collaboration, and I think maybe one other, but there was that pre-populated section at the beginning because it was based on very objective measures.
Yep, the residency program involving a collaborative approach such as consortium, F2HC, hospital systems, et cetera. 5 to 15, well, I guess 0 to 15 points to be awarded. And then the strength of application, 0 to 20 points to be awarded.
And we had those more objective guidelines for board members based on our recent scoring subcommittee. So just to kind of refresh everyone on how we got to all these scores, and they were all, compiled prior to our last board meeting. Okay, so let's go ahead. We're going to go through these one by one. I'll start at the top. Yeah.
Let's make a complaint. Kind of have money all the way down to Northwest Health Corridor Internal Medicine. And so just from like that would get us to 6.75 million if my calculator works, the number correctly. So I just wanted to catch for that.
It's my house too.
And then I have a tally. So after each vote, I can.
And we have 6.2, right?
6.236525. Be on, I believe, page 3 of the minutes.
Okay, so if when we run out of funds, we would not have, based on what you're saying, we wouldn't have full funds to get all of the Northwest Health Corridor. Is that, am I understanding that
We
right?
would be able to get family medicine, the first family medicine and most of the internal medicine, but not the second family medicine.
And staff recommends fully approving these programs rather than partial funding. Yeah, so,
And because why?
just for, sake of contracts, the state is also, well, the commission's going through updated financial processes. So we're moving to centralized accounting. And so, to avoid further delays, and confusion, at this point, the state, recommends full funding. I think, last year, the board provided partial funding, and that was in hopes of securing additional dollars.
But in general, that was sort of a stopgap approach and we want, at least from, to be faithful to this process and the RFPs and how they work, we want to just fund them in full down to when we run out. And then we'll be, the rest will go unfunded based on how we are positioned today.
And a bit behind the scenes, the board is due about, I think it's around $230,000 in unused funds from previous grantees, but that's delayed as we move to centralized accounting. So I'll have an update for you, I hope by July. And so you'll see our number bump up a little bit more beyond that 7 million. Perfect.
Okay, any other questions or clarifications before we move through the programs one by one? Okay, Marion Health, we have no conflicts on this grant, family medicine grant, scored 66.2. We had our chance to review this, a few months ago. Any discussion, questions that we want to raise on this particular grant before we entertain a motion? Okay, I'll entertain a motion to approve this grant. I'll move to approve. Thank you.
Second.
All right, thank you. All in favor of approving Marion Health Family Medicine Grant, say aye, or raise your hand. Aye.
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 Any opposed? Okay, the Marion Health Family Medicine Grant is approved. Second grant is Ascension St. Vincent Evansville, and they are an internal medicine program, 1.755 or 1.7, 1.755 thousand, score of 63.9. We have three folks who are going to recuse themselves, but I want to just open it up for any discussions or clarifications on this grant before I entertain a motion. Oh, yeah, Jennifer, motion approved?
Second.
Okay,
For protocol's sake, because we've got some folks online and also just to document the fact that some recusals, so we do a roll call vote.
oh, a roll call vote, okay. Lucas, can you help me with that?
Yes. So our recusals, Dr. Jennifer Choi.
Yay.
Okay. Let's see, Dr. Cliff Knight.
Yay.
Dr. Rachel Shockley,
Yay.
Andrew Zagel,
Yay.
Dr. Kevin Gepke,
Sorry, you cut out. What is the question here?
we're doing a roll call vote for the Ascension application, so yes or no?
Yeah.
Dr. Tricia Hearn,
Want me to vote? Should I be voting? Okay, okay. Yay,
that is 6. That should be approved.
okay. Wonderful. All right, second one, is the Ascension St. Vincent, Evansville Hospital Internal Medicine Program is approved.
The board maintains $3,671,000 in available funds.
Okay, perfect. Thank you, Lucas. Northwest Health Order, Family Medicine, this is the PGY2 start year. Any comments, questions, clarifications on this grant?
So this is for 540,000, right?
Correct.
You struck through the 810, so it's 540.
Correct.
Okay.
All right, hearing none, I'll entertain a motion to approve this grant.
Motion to approve.
Second.
Thank you. I think this one has no recusal, so we'll just do a standard vote.
Technically, they all have to be roll call votes.
Oh, they do.
Folks online, but unless there's documentivity. No harm with it.
Okay, thank you. All right, all in favor of approving the Northwest Family Medicine Grant, say aye.
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 Any- Thank you. Any opposed? Okay, that one also approved. Southwest Indiana, internal medicine for 810,000 for 51.7. Any questions, clarifications, discussions on this grant? Then let me, I'll entertain a motion for this one.
Second.
Thank you. Any discussion? All right, all in favor? Roll call. This one has, sorry, I forgot, sorry, 3 recusals, as I understand it, so we will do a roll call vote. Lucas?
Dr. Jennifer Choi,
I'm recused.
see Dr. Cliff Knight,
Yes.
Dr. Rachel Shockley,
Yes.
Angie Zagel,
Yes.
Cannon,
Yes.
Dr. Kevin Gepke. Was that a yes, sir?
Yes, correct.
Dr. Grace Grice,
Yes.
Dr. Tricia Hearn,
Yes.
that is 6.
Okay, approved. Perfect. That one is approved. We are now at the Southwest Psychiatry, correct? Right, yes, okay. All right, 1,080,000 for 51.7. Any questions, clarifications on this grant? Or we entertain a motion.
Just to approve.
Thank you, thank you. Any further discussion?
Madam Chair, one moment, I need to reword my sheet, just one moment.
Okay. And this one also has recusal, so this will be another roll call vote.
And which, grant we're talking about again?
Southwest, psychiatry for
Psychiatry.
1,080,000 or
Okay.
1.7.
And the board has 2.3 million to spend right now.
Okay,
Who made the motion? Cliff. Okay. And who seconded?
Okay.
And we have our 3 recusals, okay. So let's go with our votes. Dr. Cliff Knight? Yes. Dr. Rachel Shockley?
Yes.
Angie Sigler Hannon?
Yes.
Dr. Kevin Gemke?
Yes.
Dr. Grace Grice?
Yes.
And Dr. Tricia Hearn?
yes.
According to my count, the board maintains 1.2 million after that. 1.241.
1.241,
Yes,
and our next grant's 1.7.
correct. So based on sufficient funds, the board will not be able to approve that grant.
So we can't do partial funding.
Staff would recommend against it.
So are you recommending we drop down to one that you can fund? Or because of the scoring, you gotta stop?
That's up to the discretion of the board. The board does have that ability, but I can't provide guidance on either way.
Think about this, I didn't think about this, okay. So if there's. It's all or nothing?
That's their recommendation, right?
Right, staff's recommendation.
The board could approve funding up to the amount that we have available. Is that?
That's correct, yep. So that's the board that looks to spend it, they can, or it can roll over until our next fiscal year.
Move to the next request on this. That could be fun.
I would recommend the board vote, do one of two things, either give a partial to the next in line voting, or don't do anything. And that's skipping one, it doesn't seem right if you are relying on the scorecard. Put a score out there, jump in one, because it happens to be the dollar amount doesn't seem equitably.
And some behind the scenes, this was disclosed to the grantees that there would be, type funds. And so it was communicated that, previously programs had applied for partial cohorts. And so this was a decision on the behalf of the applicant to apply for a smaller number of individuals or the full cohort. So every party was, privy to the constraints.
That there may be insufficient funds and they may not
Correct.
get their full grant award.
Correct.
A motion on the table for discussion. I would move that we approve funding the Northwest Porter Internal Medicine to the amount of funds available. And similar to how we did these last year, if additional funds would become available, then fund to the full amount requested. That's like if money showed up
Right,
next
that
week
makes
out of the blue,
But am I understanding your recommendation correctly before we move forward, that that's not what you're wanting us to?
that's not what
That's the staff recommendation.
I see,
The
I
board
I'm making the motion anyway, so.
You're making the motion.
But at least to get something out there to officially have a motion to discuss,
Okay.
that would be my motion, would be to fund to the, up to the amount that we have available.
Lucas, quick question, why would the staff recommend against partial funding?
It's like, probably a second before we get to discussion, yeah. All right, I'll second the motion. Thank you, second. And now discussion, yeah. Thank you.
So, question is, what is the reasoning behind the staff not recommending partial funding?
What's been communicated to me, consistency and clarity among all grants, that's, last year it was communicated to me as,
Right.
for lack of a better term, a Band-Aid. And so, there's someone above
Got
me that sets these priorities.
I think that in my mind, well, it's a little different situation, I think, because back then we were trying to figure out how to take all of our funds and spread the mayonnaise across all the press.
Yeah.
And in this situation, I think we're just out of breath or out of mayonnaise, I'm not sure which. We're just out, so we're just gonna stop, it's a little different than if we said, let's take this remaining balance and try to give everybody left on the list a little money. I think that feels different to me.
If this was to be approved, I would reach out to that applicant, ask them to update their application and provide that to all of you, to reflect that, the budget, everything else. So,
I mean, I do think the idea that you tell the applicants you might not get anything, so be careful what you ask for, maybe kind of thing, is a little unfair because they have no idea where they're gonna end up on the scorecard, who else is applying and what is a reasonable amount to ask them for. So I feel like it's a little unfair to think that they could have predicted, oh, I should only ask for 1.2 million here.
that was just to say that everybody had the same information that we started with.
So it'd be cleaner if, rather than say we're approving up to 1.2 or 1, say, figure out as far as how many of their positions we would actually fund, and then approve funding that many positions. And then say, so, but that was in front of me, say, we can we're funding basically, well, more than half of the positions that.
Yeah, if they've got 24 positions and maybe
Yeah,
we're
so
doing
some,
21 positions or whatever it is.
whatever the,
One point 2.4 would be 27. You divide that by 45, is that what we're looking to do? That's 27 positions that you're.
And
slots that you're.
In an effort to maintain consistency, that is one option. Staff would recommend maybe perhaps approving years instead of individual residents at that point, because that is how Northwest Health Porter is listed on here. That third place score is 2 years of funding, and that is how we handled the voting last year. So the board does have the ability to do that, but in terms of consistency and continuity for future years, staff would recommend approving years rather than individual residents.
But it could be, is there a concern with doing like 7 out of 9 of their positions over the 3 years?
The board has the ability to do it. I'm just trying to
Yeah,
indicate the continuity and consistency.
It looks like they have 13 a year, is that what they have in their program?
For Northwest Health Porter, yep, 3 years, 13 residents, is what's being requested on this application.
And so we actually have money for 27 of the 39 requested, so we could fund 26, which would be 2 even years, whichever years we decide to miss.
Each year is 585,000, so like what, 1.6 million? Let me pull my calculator.
Should be right around 1.2. Just under.
Yeah, you should get 26
1.17.
positions, that'd be 2 years.
Correct.
So you can get 2 years.
So that would make it even if we give us a little change.
And the board would have a bit more data to operate with at that point, but that would be staff recommendation.
I'm happy to amend my motion to reflect a, or how many positions do we say?
26 positions.
20,
So
yeah, 26 positions.
versus the 39.
Of the 39 requested, I think my motion would be to fund 26 of the 39 requested.
Okay, well, second, thank you. Any further discussion on that?
Clarify that we're saying two years, like PGY1, PGY2, or that'd be helpful.
It would be PGY one and PGY two, just in contract terms, starting in May.
Okay.
And who made those motions? Sorry, okay.
Dr. Knight, Dr. Thorson. Okay. Any other discussion? Take a vote. Okay, all in favor of the funding, Northwest Porter Internal Medicine, 26 of the 39 positions for the first 2 years of the grant cycle? Say aye.
I
Like,
That's unanimous.
Any opposed? Okay, that is approved. We have spent nearly all of our funds. I think we got to the mission we wanted to achieve today. This is good.
I will give you that updated, well, 1 second.
Okay,
The board, the general fund is now at $71,525 to be at this point carried on into the next fiscal year, July. Yeah.
perfect. Okay, well done, everyone. We did it. And, you know, I know it's disappointing because we have some very deserving programs lower down on that list that are unable to obtain the funding that they were hoping they received. And, you know, this is a part of the journey that we've been on, knowing that we would at some point hit this crossroad. This is really where the rubber met the road most acutely for us. We tried last year to do that sort of workaround approach, and now we're really at this place. But, you know, I think we have been faithful to our process and the RFP and how we designed it. But it would always be better if we had more funding and could continue to support all of these programs. So, but thank you for the hard work that board has done and all of these programs that are happening. I know there's many people here or present virtually who have been part of these programs, so.
And in a fashion similar to last year, I will reach out to the board members, again, to review the scoring process and any updates that might be made to the RFP prior to being published. So that will happen likely in a month or so. I'll reach out to the board members. Okay.
All right, well, let's move on, if that's okay, to our next agenda item, which is
I just have one
Yeah.
sort of clarifying question. So for the ones that aren't being funded, we hold on to those in the very unlikely event that we do end up getting additional funding for this fiscal year, that we could go back to revisit those at that time. Is that what the thought would be? That
I would reach out to those programs and ask if they're interested in that. You know, the board has the ability to call a meeting, funds were to arrive.
and I just,
At some point, you know.
just want to kind of keep that on the radar, that if in the very, very unlikely event that more money was available, that we could go back to reconsider these now at that point. So,
Yeah.
yeah, good.
I think for educational purposes too, in the future, when there is a hope that there will be additional funding, that you also keep tabs on the number of slots that you did not approve in the state of Indiana.
That's true.
Yeah.
And make note of that to as many people as we can.
And perhaps even the geographic location.
Yeah, I'd have a map, right?
Yeah.
Yeah,
It's very frustrating.
Sounds like a dashboard.
yeah, and if they're above or below the cap, might be in, you know, some various pieces of who's unfunded by this process, but where are they, what's their status, and are they under the cap or over the cap of that institution?
So I'm afraid there will ultimately be decisions made financially that will dictate a reduction in the number of slots in Indiana because of the lack of funding. So I think use that to our benefit and to educate the legislators who decided not to fund it to the level it has.
I think that's very fair. I can work on that. Yeah, I've documented that. Thank you. That's a good suggestion. Thank you, Brad. Okay. Well, let's move on to our next agenda item then, and that's to talk about, a few different presentations and opportunities, very, in line with what we've been working on as a board for those of us to advocate, board members to advocate when they have the opportunities to. And I know people did this individually, and some of us did this a little bit more in a structured way, to try to ask, people who have influence on the legislature to consider the needs that we have described. And so Dr. Knight and I we were invited to the Indiana, Business Health Collaborative in early September. And that's a group of business leaders across the state who are very interested in advancing health outcomes and what can they do and how can they be influential, led by Luke Messer and others. But they're representatives from different industry and different sectors and all very, that's the second time Lucas and I had actually gone to that presentation, maybe January, I guess it was, trying to explain this conundrum that we're in and how we need more funding and how difficult positioned Indiana is in terms of the ratio of doctor residencies left in our state compared to other states, and what the return on investment is and the gap that we were trying to close, and if people could leverage relationships and influence, and they had the opportunity to make these talking points that they could, would be able to use their influence and help us in this cause. And I think that group was very receptive. I'll have you chime in on any insights you had from that meeting. People really engaged with this conversation every time we brought it forward. People are very interested. They want to help. And we're trying to figure out the right avenues in terms of how do we get this in front of the right people at the right time without, in a wise manner, in a wise and measured manner, but getting the right audiences where we can.
Yeah, again, exactly what Kern said. The group was very engaged and very, they are all trying to figure out, so who do we call, who do we talk to, so I think as we look at sort of two upcoming horizons, one is for the next fiscal year, even though the state budget has already been set, is there any opportunity to try and increase what the board is given right now for the next fiscal year? Again, very unlikely with the budget already set, but we're trying at least to get the word out there so that then a year from now, as they're going into the next budget cycle in the legislature, that again, we have a strong and visible ask of increasing increasing the funding so that we can move forward successfully than we've been able to this year. And so, yeah, that's kind of the message that we continue to get out there is that we're looking at a longer horizon, trying to find additional funding. And I know that everybody's trying to figure this out. And anytime I meet with an individual legislator, they're like, well, this is a slam dunk. I don't know what the problem is. Well, okay. But still didn't get it done. So, it's one of those things, but we'll just have to get to a critical mass at some point. And I really appreciate your suggestion, basically, that we make sure that those who didn't get funded, especially the legislators in those areas, that they're aware. Because I think that's what it's really going to take is somebody behind closed doors when the legislature is meeting, legislators who see this as something they want to champion. And so I think we all continue with any relationships we have with our local legislators, but especially in these areas that represent the programs that didn't get funded. So, yeah, so we're out knocking on doors and answering any questions that people have. But GME is just it's not something that people really understand because the vocabulary is weird, funding is weird. And so just trying to help people understand that continues to be something that just all need to be doing, I think.
Yeah, but I think that receptivity of that group was excellent.
Yeah.
And so we just have to continue those opportunities as board members when we are able to. So Lucas and team provided some background slides for us, and then Dr. Knight and I went to those meetings. But if there's other opportunities like that that come up, you know, we've got the decks sort of ready to go. If people have other opportunity to help spread that message, we would, you know, be happy to share that, or Lucas can adapt some of the background information that we have for the audience, depending on their needs.
Well, I sit on IBHC and I will commend Dr. Kern and Dr. Knight. Guys, and you guys did an exceptional job, and they do have nothing but positive to say about why wouldn't we do this? Why wouldn't we grow slots in the state of Indiana to be able to keep those residents and keep the brain drain down? We just have to somehow figure out how to get it translated into actual funding. So,
Yeah. Well, so just wanted to, bring that to awareness for the board, and know that we need to, you know, continue it and up these efforts wherever we have the opportunity, as board members, and as individuals. So thank you to Lucas for the
To
support.
pull on that thread, if you have an opportunity to present and you'd like slides, please let me know. And 2 days, notice would be great, and I'll see what I can do. Happy to do that.
Yeah. Good. Go ahead.
I'm just curious, you know, we have $70,000. We had talked a little bit about re-engaging, you know, either Tribunbuck or some other consultants to sort of look at our landscape and what the next set of needs are, because I think we are maybe sort of at capacity for some specialties, maybe not, like we have needs in other specialties that were, you know, that are gonna take a lot of strategy actually to figure out how to do them, but I wonder if it's time for that.
Yes.
But how do we go about that, I guess? Maybe is that started out of us, or is that out of somebody else? Or
No, yeah, so, we just had an update from Commission Financial Leadership this week. We have to have requests for proposals published for at least 30 days, so, and then, you know, approved by Commission Finance Leadership. And so at any point, members have points that they're interested in, I'm happy to gather those, and compile some kind of a document, one for board members to react to, and then my leadership. It can't be just trip on block, it needs to be a public solicitation, but.
For the ones that are, whoever would apply, right, and be considered.
yeah, I only mentioned trip because they're right.
Yeah.
Yeah, but I think this came up at our last board meeting as well, and when Hannah Maxey came and presented from the Bowen Center, it's come up through many threads. Are we in the right disciplines? Do we need to change the disciplines on our RFP? We could do that potentially if a report or data showed that we needed something different, we could de-emphasize certain regions potentially. If we're, there's just lots that we could do if we had more granular information about the density of shortages in certain areas and certain specialties. So I think we would like that.
Yep, now that I have the direction from our chief financial officer, I can kind of start to put something
Okay,
together.
do you need a motion from us today, or just you'll start? Something?
Yeah, I can just draft something
Okay.
for members to react to.
Bring it to a future meeting. Yeah. Okay, yeah, that'd be great. That would be a great use of the potentially that remaining fund balance if it works out. To help guide us in this sort of 2.0 version or 3. Whatever version we're in of the board. Because it is a different environment right now with the limited funding. Thank you, thanks for that suggestion. Okay, Lucas, the other thing we wanted to talk about was the
RHDP.
yes, thank you.
So, not a whole lot of details to share other than, an application was submitted for the Rural Health Transformation Project on October 3rd. That application asked for funding over 5 years. It's going through FSSA, so I won't really share the dollar amount because I'm sure it'll be manipulated at some point later down the road. And so I'm waiting for an update on that, but there, yeah, October 3rd, that was submitted. That is federal funding.
So we're hopeful. Thank you to Lucas and others for pulling together that report on fairly short, real short notice. And thank you to Jen Choi for pointing us towards it, because I think it could be, if we were able to obtain some of those funds, it would be huge in terms of that support. The other thing we had asked you or your team to look at was the opportunity with Medicaid, with federal match dollars. Do you have an update on that? I know, yeah.
Well, yeah, perhaps Brooke, would you want to take a lead on that?
Sure. Brooke Mullen, IDOH Executive Director of the Health Workforce Council. Yes, Lucas and I had a wonderful meeting with some individuals from the Office of Medicaid Policy and Planning, as well as their contractors. So I feel like we finally got the right, after asking lots and lots of questions, got the right people in the room. And what was the quote, Lucas? Every time federal or every time state dollars go unmatched, Secretary Rowe sheds a tear. So he would like to see as many state dollars matched as possible. So there are a lot of constraints that we're working up against. There is a max number that they can match dollars with altogether, and lots of other programs are cobbling together these matches, but they are amenable to looking into this as a potential solution. It is not a double, I think that what they said, but it is a certain percentage that they could provide match. So this is something that Lucas and I are working together on, and we're really excited about the opportunity. So we will keep our fingers crossed and stay engaged. There's a lot going on with Medicaid right now, so we just hope to be a part of that.
That's great news. So thank you for taking the initiative to get that connection made, and hopefully we'll have some good information come out of that. Could you also provide some update about our relationship with the IDOH?
Yeah, so it's been communicated to me that at some point in the future, the Graduate Medical Education Board will have a new home at the Department of Health. Timelines, details is still being clarified. And it's not just GMEB, it's several other, programs that are housed at the commission that will be moving. So no update other than at some point in the future. Yeah, that will happen.
But I think that there is, had been, people were aware of some of our members were aware of this, and I just wanted to, just have us share that is likely the direction we'll be going, and we expect that to happen. Not sure on the time frame, but I think it's been great to have the past 10 years, I guess it's been under the Commission for Higher Education, but there may be some really wonderful alignment in the IDOH that we can have with the other workforce groups that are engaged over there, and the support, and Brooke, and I know that's already, I think, been, helpful, very helpful for Lucas in many regards. So, this could be, I think, a really good thing for our board. But, details are forthcoming, but at least directionally, that is where we expect our board to live, go forward. At some point next year, probably. Questions?
It's important to say, including Lucas.
Including. That's right. Absolutely. So, I think that, it'll be a real, I think it'll be synergistic, actually. Good. Great. Okay. Well, I did, I wanted to just bring up one thing, because I know there's many in the room on our board who, I had some conversations with before this meeting. I just want to sort of bring up one issue that I think we may want to consider for the future. And that is how we score, how we define in our scoring rubric what a new program is. I think to the point that has been made today, it is financially really challenging for health systems right now. And there are going to be partnerships that change in healthcare, and sponsoring institutions can change, and residency programs can find new homes in different ways. I think, that's happened in our state to some degree. It will continue to happen, I have no doubt, because of the challenging landscape and partnerships that are occurring. And so what has been raised to me as an issue, and I think the board, I'd like at least for us to start to consider it. There's no urgency, because we have a whole other year until we're scoring some of the same types of grants, well, it would be, I guess, next July, 9 months away, till we're scoring the same types of grants that we scored today and awarding grants, but what is, sort of defining when you look at, our RFP, what is a new program and what constitutes a new program? And, I just wanted to, bring that up for our board to think about. And we may need to consider amending or updating our RFP so that, we take into consideration things that we maybe didn't think about when we built these RFPs early on in our journey, as a board. So I just wanted to raise that and, see if there's any comments or questions on that, and we can convene a small group to maybe consider working on that, if that's something that the board is interested in.
Kind of on the starting point, education vertical leadership has also indicated that they would like to review these RFPs to ensure that just another layer of making sure that everything is covered.
Everything's clear. Everything's very clear, and that people understand, that we give clear guidance in the RFPs, the programs, that, because right now our definitions are not only, they're vague, they're, new is new, but there's no what is new. I can think in my own health system how something could happen where a program could change sponsoring institution and, there could be things that happen in organizations, and I think it will continue to happen because of exactly some of Rob's points that you've been very passionate about making with this board, that the health systems have to make tough decisions and consider the financial implications of these programs, and without this funding especially, then, that may force even more issues around, shifting of positions, shifting of programs, shifting of, different elements of the programs, or splitting them off, or, whatever could happen.
That seems like a healthy step to me, is to kind of step back and look at how we're defining things and that sort of thing. And as it's become very evident and we have limited funds, part of the definition of the new program, we may need to put like a limit that we would consider grants up until the first cohort has completed, and then once they're fully filled with the 4-year program, they've now got a full 4-year class. They're no longer a new program. And do we want to look at then proposing a sustainability grant on top of the 3 we already have? Because it feels like that's where we've run into a brick wall here recently, is those programs that need something to help them from sustainability. And that one, the metric, the rubric may be totally different. It may be based on the fact that they just don't have those programs funded at all for CMS now that they're up and going. And so we may want to look at a 4th type of grant, a sustainability grant, that then has more of a need-based approach to it. That would just be a concept to consider, I think. Because that's where I feel like we're really, where I worry about these programs that have successfully gotten up and going through these new program grants, but now they still need some additional help to keep them viable, to sustain. And that's where it sort of breaks your heart, is if you've got a program that you saw them start from the beginning, but now they're going to have to scale back because they don't have the sustainability. And so that just a thought from the standpoint of the definition of what programs are available or eligible for those expansion grants, and when does that eligibility end, and then hopefully another grant for sustainability, something like that.
Yeah. I hope that the 2 years from now, the money is there and we don't have this issue, but I don't think that's gonna happen. So I do think, as Dr. Knight mentioned, what I think about are those hospitals, those programs that are showing up that did not get voted in, that have never received any grant monies for those slots. And I think the thing that I would encourage you to look at on defining a new program is having to look at whether programs have received grant monies in the past. And look at it from the perspective of not necessarily it's a new program in the eyes of ACGME as much as they have never received any grant funding, period. And if an institution hasn't received any grant money, period, then maybe that money, maybe those points should be better distributed to those that have never received it. Because you got some in there that have never received any that are not getting voted on now, and that's disappointing for them. So, but you got time. You got time to look at the whole thing, and I think do a deep dive and try to figure out what is most equitable.
Mhm. Yeah, David? Go ahead, you're gonna say something? Right now.
No, go ahead and I'll see that.
Yeah, I mean, I think just sort of understanding the letter and the writing and how we constructed these, it just brings it, so it's so much more real, okay? We have to look at this now that we're in this situation where we are not able to fund each grant. I mean, we didn't have to be as discerning about reading every line we had written in that initial RFP, but I think now we want to be very faithful to a limited resource environment and how to apportion the money in the buckets that we as a board feel is most comfortable. So that's one reason why this, sending out another RFP to make sure we understand. And that may be part of the RFP question too, right? That we put out, what do health systems, do they need that sustainability grant? I mean, is it realistic to have the 3 buckets we have, or do we need a different bucket of grants that help support ongoing, so the program don't close? And so I think these questions are very fair and we should be entertaining them as we get into this phase of limited funds. Go ahead, Angie.
So I think that the scoring tool works. So all the revisions that were done, it was a test, and that's nice to see. As I was looking at the applicants who were remaining, I was wondering in my head, some of the questions, have they received funds? Has that county received funds before? Is that important? I think, but so I think if we have some time, work on this while it's fresh on our mind before the next cycle, and think about how important it is. Because you and I talked about it does no good to start one up here, one door over here is closing. But yet at the same time, that could be a whole different ask of our legislators. Because I went back and we're kind of getting grounded into what was this board originally, designed to do. I think we stayed true to that mission. But maybe there is a second mission we need to be tasked with some additional discretionary funds that could be used so that we sustain our GME, pipeline. So that's something I've been thinking about a little bit. And then the question I had, we were talking about is, do we know where are the programs that seem to be thriving the best? Like if you're looking at sustainability, like can we identify that? Can we look at the what are kind of the core, ingredients that they have to that recipe? And then could we somehow incorporate that into our application? So we're looking at investing in, really strong, the ones that have, the community commitment and everything needed really kind of to have its best chance, I guess, at thriving moving forward. But I actually think this could be an opportunity to ask for new dollars. And why not?
Yeah, absolutely.
But I do, and then well done in navigating through this as our board chair. Thank you very much. And Lucas for supporting it. But I also, there's ways that we can put some, phrasing in the next application where we say the board may consider X, Y, Z if there's not enough funds. It allowed us a little bit more flexibility than just going down the line, because maybe we didn't hit, OBGYNs is kind of important in our state.
Yeah, and if it had a lower score, would we have the authority to consider factor like that. Or do we figure out how to put it into the rubric, which is, it's tricky, right? Yeah.
Trish, this is Steve. I think whoever mentioned, I know we've been thinking about doing another assessment to see, what we've grown. So if you look back, like 10 years ago, we had one psych program. We've now have added, communities, and there'll be at least three more. So and multiple internal medicine and family medicine. So I do think sometime in the next 6 months, we should really take a look at that to see whether we want to change the rubric in terms of programs too.
Yeah.
I think that ties into what you're talking about right now.
There was an effort this last session, I think, to incentivize medical educators, especially medical outreach receptors. And I don't know if that was driven largely at students or also at residents, but I think for us to expand in some of the places that we really need to, that actually is going to have to be a huge piece of, kind of what we advocate for as well. Again, a little bit on the edge of the scope of what our job is, but we can't expand if we don't have people willing to do the teaching. And so from that perspective, I can push them.
Yeah, that's a great point. It's such important work all around. And so I guess as an action from some of this, one would like to create an RFP to give, someone to and analyze the data a little bit more deeply on our current progress and see where the gaps are and then how to help us focus. And then in terms of looking at our RFP and maybe adjusting any language, would you recommend we get a subcommittee, or how do we need to move that forward?
Correct, the subcommittee, at least that's what's been done in the past. I think this last year, the subcommittee met at least 2 times. I think it was 3. And then that was brought to.
Yeah, I mean, we may need some wisdom from that RFP first, but there's some things we could probably even start working on or digging into. So I guess if folks are interested in being a part of a subcommittee that would work because it's too hard to have all 10 of us, I think, digging in on this. But if there's people who feel passionately about this and like to represent the board on a subcommittee to help evolve the RFP, we would welcome that. So let Lucas know, or you can send an inquiry out after this meeting
And that was all done virtually, and it'll be recorded. Everybody has access to the SharePoint site now, so even if you're not able to attend those sessions, however many they are, please feel free to provide feedback and I can export it.
Yeah. That would be a good focus for early 26 for us. Yeah. Okay, wonderful. Anything else on that? Great. I have a board member resolution to share. Rob McClinn is completing his time as a member of our board. Thank you very much, Rob, for your service. I'm going to read the resolution as I standardly do that you are going to receive. So this is a resolution to recognize Rob McClinn for his service to the Graduate Medical Education Board, whereas Indiana currently has a shortage of over 800 physicians, and whereas increasing the number of physicians, especially in rural and underserved areas, improves the health and quality of life of Hoosier communities. And whereas the Graduate Medical Education Board was established in 2015 to expand GME in Indiana by funding new residency program slots at licensed hospitals and qualifying nonprofit organizations. And whereas the GME board is comprised of 10 gubernatorial appointees representing key public health organizations and associations throughout the state, whereas Rob McClinn has represented a non-teaching hospital in the Indiana Hospital Association and the Graduate Medical Education Board since 2022, and served the graduate medical education community and the Indiana residents with distinction. And now, therefore, be it resolved, the Graduate Medical Education Board expresses its deep appreciation to Rob McClinn as he concludes his term of service, wishes him continued success. Thank you.
I've learned a lot. Whereas Rob McClinn also approves a $6 million increase to the Indiana GME board funding for the next 2 years.
What a wonderful thing.
Should add that in.
We appreciate your contributions, your perspective, the wisdom you brought to the group, and, because this is complicated work. It's really important and complex work, and I think you brought a great perspective for us to all consider, so thank you. Yeah. And we will, so we do have one open board position from, Tom Sonderman's position, and then we'll have Rob's, open as well, and Lucas and team will be working to get those filled. It's been a little bit of a delay with, particularly Sonderman, perhaps isn't yet, truly vacant yet, but we'll try to get both of them filled as quickly as possible, so we get back up to our full complement of 10.
So those are the ISMA and State Medical Association.
Correct. Sonderman
And
was,
IHA, Indiana Hospital Association, those are two positions that are.
that are open, yes.
Yeah, and I know the hospital association, Laura Brown, I think they are working on it. And they're working toward that.
And the ISMA had, also had, well, we met, the person that his name has put forward, Rachel Reed, she was here at one of our meetings. And then we've just been waiting on, getting the approval, so she hasn't, officially joined, obviously. But that's who the ISMA put forward.
Once that happens, I will update the board's onboarding, but overview document. And that'll reflect, full funding, the application that were approved today, et cetera. So, just more, like I said, it's like,
Okay, I'd like to open it up for any public testimony and, not to put our student members on the spot, but I'd love to hear if you have any comments before we close too. But I'll give you a second. Any public testimony, anyone wants to share?
This is Doug Boyle with ISMA. Thanks for the opportunity. I apologize. Just wanted to confirm the appointment positions are still pending, correct?
Correct.
Okay. Appreciate that. And I know that you guys touched on the Medicaid GME funding piece that you guys are working on that. Obviously, ISMA is particularly interested in supporting those efforts. So if Julie, if we can be supportive to Lucas, you and IDOH, as you guys look into that, please let us know.
Wonderful. Thank you, Doug.
Thank you.
Any other public testimony? Yeah, Dr. Donovan.
I'd just like to thank the board for your consideration of our grants and for the approval. We're excited to get this new program going. We've got our first bus in place right now and it's doing quite well. It's definitely been a challenge with our low cap numbers. So reclassifying as rural referral definitely is a big plus for us because this lets us start setting in the direct cap with the program. So thank you very much for your support and thank you for all the work you do.
Thanks for being here today.
Madam Chair, if I may, if board members would like to invite any presenters to come and share data at any of the upcoming meetings in 26, please let me know. I know the Bowen Center typically shares with us at least once. But if there are any other parties that you think may be beneficial, just let me know and I can start reaching out.
Good members? Claire, I'm sorry, but like that. Yeah. Anything you want to share about the insights from today? I didn't know what you were getting into when you joined this board.
It's very interesting to see the process. As someone who is considering an Indiana-based residency program in the future, it's kind of nice to see the behind the scenes and what it takes to really increase funds for future students. So I really appreciate the opportunity to be here and see how it all works.
Thank you for being here.
I have the same thoughts. My goal is to stay in Indiana long term, but unfortunately, Indiana only has one emergency medicine residency program in the entire state, and I know soon to be two. So that kind of pushes a lot of people that want to pursue emergency medicine out of Indiana. So I think that other people have talked about looking at programs that didn't have a lot of numbers. So I think that is kind of the area that you guys are looking into to see how you can increase numbers of those physicians to keep them in Indiana also.
It's always great to hear from our students because you are living this experience and you're closest to this need. So thank you for being here and your perspective. All right. I think other than that, I think we've completed our tasks for today. Appreciate so much all the commitment, engagement, and just thoughtfulness of this board. So we will see you all at the January meeting, and I'll entertain a motion to adjourn the meeting. Motion to adjourn. Thank you. All right. We're all set. Thanks, everyone. See you in January.